I'd like to welcome everybody to this webinar. We've had a few webinars in the last few months in regards to the COVID-19 pandemic, and we hope that you have found them informational and beneficial. We also will be starting up some other webinars coming up in the next few months regarding other areas of your businesses besides just working on the COVID. So please be looking for that information. My name is Natasha Bothan. I'm with the Department of Tourism. We have a lot of other opportunities, our past webinars, our hospitality training, and other items on sdvisit.com. If you have any interest in learning more about other areas that we can service you, please go to sdvisit.com. In regards to this webinar this morning, I just wanted to let everybody know that it is being recorded and it will also live on sdvisit.com with all of our past webinars. So if you missed something or you'd like to have other people see this webinar, please direct them to sdvisit.com. Please mute your phones while this is going on. If you do have any questions, please use the Q&A button down at the bottom of your screen. All questions will be answered at the end of the presentation, as long as there is enough time. If time does run out and there's still questions, we'll make sure that we get those answered via email after the session. Now I would like to turn it over to the Department of Health, and they can begin.
All right, thank you, Natasha. And thank you for the opportunity to speak to all of your tourism partners. I'm Bill Shellcraft with the South Dakota Department of Health. I'm the administrator for the Office of Public Health Preparedness and also for the Office of Health Protection. I'd like to start out by introducing our presenters for today. Hannah Parsons is an infectious disease epidemiologist working with our Office of Disease Prevention and has been focused specifically on COVID-19 since the outbreak started. Hannah will give a COVID status update by region, discuss how businesses can protect their employees and customers, as well as what to do if you have a positive case of COVID in your business. John Osborne is the Assistant Administrator for the Office of Health Protection and will provide guidance specific to food service facilities and restaurants. Joan Adam is the Division Director for Administration, which includes the State Public Health Laboratory, and we'll go over the role of COVID-19 testing. And then we'll conclude with a question and answer session. I'm going to start things out with a brief overview of COVID-19 in South Dakota. What is COVID-19? It's a viral illness caused by the SARS coronavirus. It typically causes mild to severe respiratory illness, but in some individuals, they have no symptoms whatsoever. The next slide will show each of the various symptoms and how often they are present in South Dakota's positive cases. The overall percentage of individuals not exhibiting symptoms is thought to be around 15% in South Dakota or higher. The virus can also cause lower respiratory tract illness, such as pneumonia or bronchitis, and in severe cases, can lead to death. All right, this chart indicates how often the various symptoms are present in South Dakota's positive cases so far to date. Multiple symptoms are often exhibited by an individual case. As you see here, headache is the predominant symptom that is indicated by South Dakota cases, and that's about 43% of all cases report headache. Fatigue is second at 40%, muscle aches and pains at 37%, fever and chills 32 and 28%, sore throat 23%, loss of smell or taste 23%. And you may recall that loss of smell or taste wasn't one of the early symptoms that was indicated, but throughout the course of the outbreak, it was discovered to be a fairly common symptom of COVID-19. And then you can see it goes on downward to some of the minor symptoms, rash being at 2%. All right, how is COVID-19 spread? It's spread primarily through respiratory droplets when you inhale or ingest small or microscopic respiratory droplets from an infected person. These droplets are expelled by infected individuals when they cough, sneeze, or talk. Singing, exercising, and loud talking all increase the amount of droplets that are expelled. You typically have to be within 6 feet of the infected individual for 15 minutes or more to become infected yourself. If you are infected, symptoms typically appear anywhere from 2 to 14 days after the exposure. Individuals are also able to transmit virus to others 2 days prior to the onset of symptoms, and then throughout most of their course of illness. This is why it's important to wear a face covering when you're not able to physically distance yourself from others. The face covering limits the amount of respiratory droplets a person expels, plus it also provides a little bit of protection from inhaling or ingesting droplets from others. All right, here's a timeline of COVID, starting with the first case discovered in Wuhan City, China, back in December of 2019, December 31st. The US saw its first case in Washington State back on January 20th, and South Dakota saw our first cases on March 10th. A day later, the World Health Organization declared COVID-19 a global pandemic. And as of today, South Dakota has seen 8,077 positive cases, with cases in all but 2 of our 66 counties. Currently, we have 24 counties experiencing substantial community spread. All right, the next slide is an epidemiological curve of daily new cases in South Dakota by date. It starts out on March 10th with our first case, and you'll note 2 distinct peaks followed by a fairly flat period. The first peak in mid-April was primarily clusters of cases in Minnehaha and Lincoln County, along with a smaller cluster in Beadle County. The second peak in early May was a mass testing event in Sioux Falls for employees and family members of a meat packing plant. To drill down a little deeper into that, the most recent data, this chart shows the 14-day trend of daily new positive cases in South Dakota. And it indicates that we're continuing to head in the right direction with a slight downward trend. You'll note, though, this is not the norm in the rest of the country right now, and we need to make sure we continue to practice appropriate measures to protect ourselves and others. You've all seen the rapid rise in cases in several other states, and we certainly don't want to head that direction. I'll now turn it over to Hannah to drill a little deeper into South Dakota data by industry and region.
Thanks, Bill, for that nice overview. My name is Hannah Parsons, and I'm an infectious disease epidemiologist with the Department of Health. I've been an active member of the COVID-19 response since it began this past spring, and I'm really happy you guys all took the time out of your busy day to join us. So on these next 2 slides, I'll be giving a brief overview of how different businesses in the tourism business in South Dakota have been affected by COVID-19, specifically the retail and food and restaurant industries. So this first slide is showing a map of South Dakota and the number of positive cases we've identified to be working in a retail business. We're defining a retail business to be one that sells manufactured goods. So examples are department stores, large grocery stores, clothing stores, furniture stores, etc. So out of the 6 regions, as you can see, Sioux Falls area has been hit the hardest, with 126 cases having been identified to work in the retail industry. Rapid City area and the Northeast region have 31 cases, the Southeast with 20, the West with 6, and the Central region with less than 5. So moving on to the next slide, we have a regional update for the restaurant and food industry. And To fall under this category, we're defining a business to be one that sells a food product. So examples are grocery stores, restaurants, fast food businesses, bakeries, etc. So as we saw with the last slide, the region most impacted by COVID-19 so far, as far as the food industry goes, is the Sioux Falls area with around 90 cases, Rapid City area with 37, the Southeast with 26, Northeast with 25, the Central with 23, and the West with 5. Okay, so next couple slides, I'm going to talk about how we can prevent COVID-19 in the workplace for both employees and customers. Many people spend a large portion of their days at work, often in close contact with other workers and the public. So it is very important to recognize and take action to prevent the transmission of COVID-19 in the workplace. So reviewing and recognizing workplace factors such as work practices, policies, and processes, along with worker factors such as socioeconomic status, language, or literacy barriers, may help identify circumstances that could contribute to disease transmission within the workplace and community. So the CDC has some really great guidance out there and recommendations on how we can all take part in preventing COVID-19 in the workplace setting, and I will go over those on this slide and the next slide. So we want to encourage you as employers to encourage your sick employees to stay home. So employees who are showing symptoms should notify their supervisor, stay home, self-isolate, and call their healthcare provider. Employees should not return to work until they've met the criteria to discontinue isolation, and that's in consultation with their healthcare providers and the Department of Health. So employees who are well but have a sick family member at home with COVID-19 should notify their supervisor and then follow the South Dakota Department of Health recommendations. So if that employee has been identified to be a close contact of that family member, we will be asking them to quarantine for 14 days. Employees who have symptoms upon arrival at work or become sick during the day should immediately be separated from other employees, customers, the public, etc., and be sent home, where they again should call their healthcare provider. And yeah, so moving on to the next slide. As in many things in life, the key to success is good communication. So we want to encourage you guys to educate your employees on how they can protect themselves from COVID-19, both at work and at home. So good education means encouraging employees to wash their hands often with soap and water for at least 20 seconds, or if that is not available, using a hand sanitizer with at least 60% alcohol. We also want to educate employees to cover their mouth and nose if they sneeze or cough, whether that's with a tissue or the inside of their arm. And then both for employees and employers, we want to practice routine cleaning and disinfection of frequently touched objects. So workstations, keyboards, telephones, handrails, doorknobs, etc. And then again, we want to encourage good social distancing by avoiding large crowds and gatherings and maintaining that distance of 6 feet or more from others when possible. So next step, we want to, as employers, we want you to identify where and how workers may be exposed to COVID-19 at work, and then take some mitigation measures to reduce the risk of COVID. Employers are responsible for providing a safe work environment for their employees. So that includes engineering controls, workplace administrative policies, and personal protective equipment. If an employee has a lot of face-to-face time with customers, something you could do is add a plexiglass barrier. And then again, reminding both customers and employees to wear cloth face coverings. That is recommended by the CDC. You want to wear those cloth face coverings when it may be hard to practice good social distancing measures, but a cloth face covering does not replace the need to practice social distancing. And then we're asking that you check in with your high-risk employees and consider examining policies for leave, telework, and employee compensation. I know that might not be doable for all types of businesses, but it is something to keep in mind. And then lastly, develop, implement, and maintain a good cleaning and disinfection plan. The CDC has some really great guidance out there on EPA-approved disinfectants, and then how often you should be cleaning and disinfecting your facility. Moving on to the next slide. This is an infographic that can be found on the CDC COVID website, and it has 10 tips and tricks to protect employees' health, most of which I just went over, but I just wanted to share it because it's a really great summary of what employers can do to prevent COVID-19 in the workplace. So protecting employees is very important, but we also want you to keep your customers in mind. So the best tools to mitigate the transmission of COVID-19 in public are social distancing and wearing face masks. So we are asking, or maybe you should consider trying to increase the space between customers you serve. This will limit person-to-person contact among customers and staff and allow people to practice better social distancing. You could consider asking customers to wear a face mask before they enter the facility, and then encouraging post signage around the business to remind customers and staff to practice good social distancing. So whether that's signs on the walls or X's on the floor while people wait in line, just to remind them to practice social distancing. And then again, encouraging you to clean and disinfect your facility frequently. So disinfecting those high touch areas again. And lastly, maintain open communication with employees and customers. So it's very key. I will hand it off to John Osborne.
All right, thank you, Hannah. Again, I'm John Osborne with the Office of Health Protection. I've just got a couple slides here I'd like to review with you, which pertain specifically with food service or restaurants and bars. You can see that we'll have three main themes continue throughout this food service portion for the COVID mitigation strategies. And that's staying healthy by maintaining good hygiene, cleaning and sanitizing areas frequently, and of course, maintaining social distancing. So I broke up this food service section into kind of two parts. This first slide is going to deal with best practices for the operations. And then the next slide will be information that's good mitigation strategies for employees. So as you can see on the first bullet, one of the most important strategies you can employ as a food service operator is practicing social distancing. We know this strategy has been proven and it works well. And this strategy, of course, is key because obviously when people are consuming food and beverages, mask use is limited. So distancing becomes very important. You're typically sitting at a table for a meal, 20 to 30 minutes. So again, you want to maintain that distancing just because you're not going to be having a mask on during that time. So operators are recommended to limit their occupancy, first of all, and then space their seating accordingly. You got to keep your tables, try to keep them 6 feet apart, and keep groups of 6 or less. That's also important when you're dealing with spacing. Outdoor seating is a great option if available, but again, maintain the distance of tables outdoors as well. And social distancing also, I wanted to note on here, it applies to employees. You should try to space your workstations in the back of the house, perhaps stagger work activities to avoid congestion with your employees. Those are good strategies to keep in mind. The second bullet is, of course, increase the cleaning and sanitizing of areas. You want to set up a schedule to routinely clean the high touch surface areas, every half an hour to an hour with approved disinfectant. Several food service operations, they're including paper or placards on their tables to indicate if a table is clean or dirty, so customers can flip them over from clean to dirty when they're finished so that employees know that that table needs to be cleaned and sanitized. The next bullet is consider limiting or discontinuing some self-service operations, especially those drink stations where customers may bring a cup that might have saliva on the lip of the cup, and then they're transferring that saliva to the dispenser. So if you can limit that and provide them with a clean cup, that would be optimum. You want to limit self-service items also for people that might be congregating in a small space trying to obtain that single service item. And so, if you can avoid doing that, that would be helpful. Consider the use of fans or open screen windows to improve air circulation in smaller indoor establishments. This has also been proven to be a good mitigation strategy. And the next bullet is to consider barriers such as plastic plexiglass between employees and the customers, if that's practical. Not in all cases, but it might be helpful in your situation. Consider screening employees. As Hannah mentioned earlier, this is a good way to prevent possibly sick or ill individuals from coming into work all day. And management should be prepared. So think ahead. If you have a contingency plan that you can employ, during this time, just be thinking of who that backup person might be, to cover for somebody else if they're out or ill. All right, next slide, Hannah. Okay, so this is the slide that we're talking about employees. And again, as we mentioned and continue to mention, stay home for employees if you're sick or ill with symptoms, and leave work also in the same conditions. Stay home if you've been in close contact with someone who's been diagnosed with COVID-19. And employees should try to wear a mask or face covering during their times when they're operating. Wash hands frequently and often, or properly, I should say. Use alcohol-based sanitizer on clean hands as needed. So if you're not available to get close to the hand sink, or if your workstation is not near a hand sink and you want to sanitize, use that 60% alcohol-based sanitizer on your clean hands as frequently. And the final bullet is to use gloves or tongs to avoid bare hand contact with ready-to-eat foods. This is a regular food service strategy, but it also applies to this COVID-19 situation as well. And the last slide I just wanted to mention is that the FDA also provides a lot of good information to food service operations. Again, it kind of stresses the healthiness aspects, the clean and sanitizing, the social distancing, and picking up and delivery of operations. So they have a handy one-page bullet points things that you can post in your facility, and it should help convey that message to your employees and operations. And then I guess with that, I'll turn it back over to Hannah. So thank you.
Thanks, John. So I'm just going to talk briefly about what happens if an employee tests positive for COVID-19 in your business. So first step, remain calm and do not panic. We're wanting you to work with the Department of Health to identify all close contacts of that positive employee. And a reminder, close contact is someone who has spent 15 minutes or more within 6 feet of the person who tested positive, which is why we're emphasizing the need for social distancing. So if you're practicing good social distancing with your employees, there may be fewer close contacts. So in most cases, you do not need to shut down your facility. If it has been less than 7 days since the sick employee has been in the facility, you will want to close off any areas used by that person for prolonged periods of time. And wait 24 hours before cleaning and disinfecting to minimize potential for other employees being exposed to the respiratory droplets in the air. If waiting 24 hours is not feasible, wait as long as possible. So during this waiting period, open outside doors and windows because you will want to increase the air circulation in these areas. If it has been more than 7 days since a sick employee used the facility, additional cleaning and disinfection is not necessary. But just a reminder that you will want to still continually, routinely cleaning and disinfecting all high-touch areas and surfaces within the facility. And this last point is a reminder that the CDC nor the Department of Health recommends nor requires your employee to have a negative COVID-19 test before returning to work. So once the Department of Health has released your employee from isolation, they are free to return to work. And I think Joan will talk a little bit more about the criteria of release from isolation. So I will pass it off to her.
Sounds great. Thanks, Hannah. Again, this is Joan Adam with the Department of Health. I'm going to begin by talking about what happens when a person becomes ill and how you may be contacted by the Department of Health throughout this process. When an individual identifies that they have symptoms of COVID-19, we are encouraging all individuals to consult with their clinician. We are also encouraging clinicians to test all symptomatic individuals and working to make sure that happens. The specimen will be collected, the laboratory test performed. The Department of Health is then notified on any positive COVID-19 result. The patient will also be notified of their result by their clinician. When we receive a positive test result, the Department of Health begins what we call a case investigation. Through that process, we will identify all close contacts to the individual who is positive. We'll advise the case to isolate at home, and then we will notify the close contacts of the exposure and counsel them on next steps to take. If you or one of your employees is identified as a close contact, you will be contacted by the Department of Health. If your business was visited by somebody who was considered to be infectious, you will also be contacted by the Department of Health. The Department of Health very actively monitors both the positive cases as well as the close contacts to a positive case until they are released from either isolation or quarantine. Although we've talked about this somewhat in the presentation, I just want to make sure we remind you of what defines a COVID-19 case. Somebody with a positive result, the individual will be recommended for isolation while they are ill. They will be, their situation will be monitored and they'll be released by or from isolation by the Department of Health when one of the bullet points below are achieved. Also want to remind you of what defines a COVID-19 close contact. As I mentioned, if you or one of your employees or your business was visited by somebody who was considered to be infectious, you will be contacted as a close contact. Remember, you may have been in the presence of somebody who then is tested positive. However, if this criteria of being within 6 feet for 15 minutes or longer of that individual while they were infectious, if that is not met or identified through the case investigation process, you will not be contacted. There are also criteria regarding when close contacts are released from quarantine, and that criteria is provided here. I also want to draw your attention to a resource that's available on the Department of Health website. This will provide you with the most current information on active COVID-19 cases in the state. I think you will find this information helpful as you monitor the activity of COVID-19 in your area of the state where you are operating your business. The dashboard is interactive, meaning you can go to a spot just below the main data sets where you can select the county or counties where you are conducting business, and you will receive data on the 14-day trend of COVID cases in your area. Good thing to watch for is we hope those trends, those 14 trends are going down. But if you see a spike or the trend in your area where COVID cases are increasing, it's a warning to be taking extra precautions and to be monitoring your employees' health as well. Laboratory testing overview. Just a quick reference to different types of testing you may hear of and what those differences are. Diagnostic testing is focusing on a patient who is symptomatic or ill and checking for the presence of active disease. We are also testing more and more asymptomatic individuals who for many criteria may be tested and identified for active disease. You'll also hear about antibody testing. This is primarily used to identify people who have been exposed and recovered from a COVID infection. Next, want to reassure you that the Department of Health is working very hard to ensure that testing is available in as many communities as possible throughout the state. The map here displays where COVID testing capability is available. Like I mentioned, this is something we're continuing to work on, but as of right now, this is where testing equipment is available in the state. And then another reference to the Department of Health website. We are updating our website very regularly, links to the resource materials that we use, as well as that are used by businesses and operators throughout the state can all be found here. Links to the Centers for Disease Control website will also be found. And then also want to provide you with the Department of Health's 1-800 number. Should you have any questions on how to handle a COVID-19 situation in the workplace setting, please feel free to contact us at this number. Your call will be assigned to the appropriate person for a response. And with that, I think we'll turn it back over to you, Natasha, for the question and answer portion.
Thank you, Joan, and thank you everybody for all of the wonderful information. We have received some questions, so I'm going to start with the first one. Do you think employees wearing gloves is a good thing since they can become infected if the wearer touches his or her face or another infected area versus frequent hand washing? I don't know who wants to answer that one, but anybody with Hannah's group or in John's? I think everybody's on mute right now.
Yeah, I can just say that for food service operations, glove use is required when you're handling foods that are ready to eat. So any foods that have been through the cooking process, you want to make sure that you're gloved up when you're handling, plates or food items, just to prevent that bare hand contact with that food. And as far as the glove use in other situation, I would defer that to Hannah maybe.
Yeah, thanks, John. As far as wearing gloves to be preventative of COVID-19 transmission, there are not a lot of studies out there as far as that being helpful. I mean, because you have gloves on, you're shopping in a grocery store, you're touching multiple items per se, and then you touch your cell phone or your face and while wearing those gloves, so it kind of defeats the purpose. So again, we're just encouraging frequent hand washing and then alcohol-based hand sanitizer. That is proven to be the most effective.
Thank you both. The next question is, what if a visitor that had been at my business weeks ago calls and said they tested positive? What should my next steps be?
Thank you, Natasha. If it's outside of the incubation period, which is 2 to 14 days, there's really nothing you need to do because they wouldn't have been infectious while they were there, and they probably wouldn't have been exposed while they were in your business. So there's really nothing that you need to do in that situation.
And just to go off what Bill said, if you have a routine cleaning and disinfection plan in place, that will certainly help with this case scenario.
So if it was, say, within the last like 4 days, they were at your business and they tested positive.
Yeah, it would go back to what is considered a close contact. And so probably chances are, depending on what type of business, that person may not, the employees or employer may not have any close contacts at that place of business.
Yeah, this is Joan. I would just remind everyone that if you an employee of yours or your business is identified as a place where an infectious person visited, you will be contacted by the Department of Health.
Okay, thank you. The next question is, if an employee that has been working for me calls in and feels ill but hasn't been tested yet, should I shut down until they are tested and have their results back?
Yeah, I can take that one. So the Department of Health would not recommend that they shut down. I mean, that employee should not be attending work. It is possible that they may test negative. So just reminding employers to continually, routinely clean and disinfect their business is helpful.
And it'd be a good time to step up your cleaning, step up your masking, you know, increase your awareness, so to speak.
Great, thank you. Being contacted by the Department of Health, is that a phone call, email, or via the U.S. Postal Service?
Yeah, when the Department of Health reaches out to whether a positive case or a close contact, we typically do that via phone, but sometimes we take extra measures to contact those people. So sometimes Facebook Messenger or via letter if we cannot obtain any phone numbers or other ways to contact them.
Okay. The next one says, we are a seasonal business. How do we determine a safe number of people in our establishment at one time? Can it be calculated by square footage of the store for an approximate number?
Yeah, this is Bill, and I don't know that there's any calculation by square footage. Generally, it's observational. If you can't maintain 6 feet of separation between different parties, you know, then you may have too many in at one time. So really, it's kind of common sense, just looking at your operation and judging, you know, can we safely socially distance different parties from each other?
And I think that's also where requiring masks of people entering your business can be a helpful tool as well.
And we're seeing more and more businesses implement that policy.
Yes, masks and social distancing are the best mitigation measures to prevent COVID-19, but masks do not trump social distancing in the end. So social distancing is key.
Okay, wonderful. Just a reminder, we did have a question. This is being recorded and we will be sending out an email in the next few days with the link. It will be posted on sdvisit.com for you to share with whomever you would like. Thank you for that question. The next question is, we run a leadership program that meets monthly. Would you recommend that we purchase digital thermometers to monitor our class members during our sessions?
Yeah, like I mentioned earlier, screening employees, customers, screening employees is a really helpful thing to do. As Bill talked about, sometimes fever isn't one of the most identifiable symptoms. And so screening for fevers is important, but also checking for other symptoms. We would definitely recommend that.
Okay. Next question, what if the visitor that has tested positive is from out of state? Will the Department of Health receive this information from other states?
So if an out-of-state resident was tested in South Dakota, we will receive that information. If a South Dakota resident is tested, for example, in Nebraska, we will also receive that information through interstate notification.
I think their question is, though, if, say, somebody from Iowa tests positive when they get back from, like, they were in South Dakota for a vacation and then they go home and then they test positive, would you be notified that they were in South Dakota, say, 4 days before this?
It's not an exact science. Some states are better than others, I guess, per se, about notifying us of possible public exposures. So, but it is not mandatory that per se Iowa would notify us that one of their residents was here.
And part of it, this is Joan, I'll just add, part of it comes down to the case investigation conducted by the state of Iowa. If that individual is forthright and shares, I just got home from a vacation in South Dakota, I was at this location, then we would expect the Iowa Department of Health to contact that location, or potentially if they had a name of a person, that person. Likewise, we'd be doing that for somebody who was tested positive, a South Dakota resident who just returned from a trip, say, to Minnesota. We would be letting them know.
Especially if they identify close contacts.
Yep, yep. So there, the variability comes into the individual testing and being able to recount where they were, when they were there, and at what time and place. And does that fall into their infectious period? Not an exact science, but it is public health best practice that all state health departments follow.
Wonderful, thank you. That makes complete sense. Next question, our business dimensions do not allow for social distancing nor for staggering shifts with employees. It's a coffee shop. How can this not be a detriment to our customers who see this, or to employees? I've already been chastised on our Facebook page, and I'm not sure how to not get emotional about this. We wear masks, gloves, as CDC and Department of Health require, so all other protective actions are being taken. Is there any advice?
This is key.
I'm sorry, I missed that. Okay.
Not being familiar with the particular situation, it's tough to really give solid advice, but if you're doing everything that you physically can, whether it be plexiglass screens, whether it's if you take orders over the phone or the internet, and if there's ways that you can engineer distancing, just be creative in how you can minimize that exposure. That's really the only advice I can give. John, do you have anything else?
Yeah, I mean, it's a tough one in certain situations, you know, depending on your operation. But if you have other means of dispensing your product, you know, through deliveries or, you know, pickup orders and that type of situation, you know, you just try to do the best you can with your particular, you know, clientele, I guess.
Thank you. The next question, what part does the employer play in contact tracing?
Okay, I can take that one. So it is not, when we're conducting a case investigation, sometimes we may have to contact the employer to help us identify the employee's close contacts at work. But sometimes the employee can identify those contacts themselves. They will have the name, date of birth sometimes, and contact info. And so it is not always necessary for us to reach out to the employer. We do offer the employee an exclusion letter of exclusion that they can send to their employer, letting them know that they are being excluded for the next 10 days or more, possibly. So I hope that answers the question.
Thank you. It appears like that was our last question, looking at both the chat and the question and answer areas. Is there anything else from the Department of Health that you guys would like to reiterate or anything before we close?
Yeah, Natasha, this is Bill again, and I guess I would just encourage anybody that's listening or watching that if you have further questions or you run into situations down the road that you'd like a little help with, feel free to call our 800 number, and we have a wide variety of expertise that can get back with you. We can look at different situations and give the best advice we can. And so that's just encourage them to do that if they have further questions.
Thank you, Bill. We really appreciate that, as I'm sure there will be some more questions that are sparked from this wonderful presentation. I'd like to thank the Department of Health for putting this presentation together and for all the attendees for joining us today. And if there's any other questions you have, as Bill mentioned, please call the 1-800 number. They're here to help, as is the Department of Tourism. If there's anything we can do, please feel free to reach out to myself or any of our team members. This presentation is being recorded and you will be able to find it on sdvisit.com, as well as all past recordings of any of our webinars. I hope that you guys have enjoyed this as much as I have, and we look forward to seeing you at our next webinar. Have a wonderful rest of the week. Goodbye, everybody.